Okay, there we go. So to everyone watching the recording, my name is Cody Hoffman, the Assistant Director of Nursing Student Recruitment at Penn State Ross and Carol Neese College of Nursing. This session is being recorded and the recording will be shared with everyone who has registered, whether you attended or not, afterward. So you can always refer back to things if you need to. If you need to step out early or you popped in late, no problem. You can watch that link whenever you get a chance. And I'll have a few more housekeeping things, but I'll let everyone else introduce themselves first. So, Dr. Motter, you want to go first?
Sure. Good afternoon, I guess I should say, everyone. I'm Dr. Sherry Motter, and I'm the Assistant Dean of the Graduate Professional Programs. Long title, but what that really means is all the graduate programs except the PhD program. I'm also an associate teaching professor and do teach within the program. Welcome, everyone. We're excited to present what we have to offer.
Thanks. Dr.
Jackie?
Ryer?
Yep, sure. So my name's Dr. Jackie Ryer, and I am the Acute Care NP Program Track Coordinator. I'm an assistant teaching professor here, and I practice clinically at Penn State Hershey Medical Center. So if any of you are in the Penn State Health Network, welcome to have you.
Thanks. And Dr. Farrell in ghost form.
In ghost form. Hello, everyone. I'm thrilled that you're all here, eager to hear about Penn State. I am the clinical coordinator of the psych mental health nursing practice, and I think that it's a great opportunity for everyone. I am in clinical practice, but not in the area of Hershey. So I look forward to answering any questions that you may have.
Thank you. And as I mentioned, we've got Morgan, if you'd like to introduce yourself as well.
Sure. Hi, everyone. Thanks for joining us today. My name is Morgan McAfee. I'm the Director of Strategic Communications and Recruitment for the college. And today I'll be manning the chat.
That's right. So we will have a nice big chunk of time for questions and answers at the end of the session. We've got a presentation for probably about a half hour or so first, and then we'll have plenty of time to get through whatever questions you have. If you want to put questions in the chat during the presentation, you can, but we won't be answering any until the presentation is finished. If you have questions that you'd like to have answered, but you have to leave before we get a chance to answer them, we'll still answer them live if we can, and you can watch the recording later to get answers. And of course, you can always reach out to us directly, and we'll be happy to talk with you on a separate Zoom call or through email or whatever works best. Few other things. If you want to turn your video on and ask your question live, you can do that. You can raise your hand so we know you have a question, not required at all. We know some of you might not have be in a space that's conducive to that right now, depending on where you're located at the moment. So if you want to just type your questions, that's fine as well. Another thing we do want to mention, this info session is going to be covering most of our DNP options. We do have a new DNP option in nurse anesthesia that is projected to open next summer. We will not be including that content in this information session. We'll have a separate info session for that program coming up in a couple of months. We're looking at a time in May right now. So if you want to find out more about that program, just keep an eye on our website. Our DNP nurse anesthesia website is freshly live as of last week. So you can go there for more information, and we'll post the date there, of course, whenever we have that set. Also, not including information on our PhD program in this session either. So we will have another session for PhD probably in the summer. And if you do have questions about either of those programs, feel free to reach out to me directly. I'm happy to answer whatever I can for you about those. But since those programs are quite different from the rest of our hybrid DNP and MSN and certificate programs, we try to keep things most logically organized so that we can make the best use of everyone's time. All right, so with all that, let me go ahead and share my screen to get started. All right, can I get a nod that everyone can see that? Perfect. All right, so just a little about us. Who are we here at the college, the Ross and Carol Neese College of Nursing? Well, we have a mission of creating nurse leaders to transform lives and health around the world. And our vision is that we will redesign the landscape of health and nursing science through education, research, innovation, practice, and service. You'll see these big overarching goals tied through pretty much everything we do in the college. We have a real focus on being at the forefront of developing nursing science and making sure that the people who are leaving our programs, people who are teaching in our programs, are actively contributing to furthering the nursing profession in all aspects. And we hope that every student that comes here will have that same intention. We became a College of Nursing within Penn State University back in 2013, but nursing has existed at Penn State since the mid-60s. We've had nursing programs for around 60 years already, so this is not new to us. We have grown from, nursing classes to a Department of Nursing to a School of Nursing, then a College of Nursing over the years, and in 2021, we were transformed into the Ross and Carol Neese College of Nursing, thanks to the very generous gift of Ross and Carol Neese. The funds that they have donated have transformed our college in several ways. They've enabled us to offer more student scholarships. They have allowed us to endow a couple of professorships. We have just completed an extensive renovation of the Nursing Sciences building at the University Park campus with an awesome active learning classroom and plenty of updated student spaces and so forth. So we really do feel sort of a fresh energy within the last couple of years that has been powered by the generosity of the Neeses, and that will be carrying forward for years to come for sure. Across our undergraduate and graduate programs, we have about 2,000 students enrolled at 12 different campuses at the moment across Pennsylvania and online. And we are fully accredited by the Commission on Collegiate Nursing Education through 2031. That's a 10-year cycle, so we're at about the halfway point right now. And most people watching this, if you're looking to get started in the next year or so, you'd probably be through the program before we even get to that next accreditation moment, whenever that comes. But we're not worried about that either. We've got lots of people working to make sure that we're maintaining that accredited status, and we are proud of the progress that we've achieved over the years and plan to keep that going for many years to come. So what else sets Penn State apart specifically in regard to nursing? So our Ross and Carol Neese College of Nursing is a pretty small corner, maybe, of the larger university, but we really think that that is a strength. We think that the small college feel that students get here allows them to know that they are supported. You get to know your faculty, you get to know the staff, you get to know the other students in your classes. And we really do our best to make sure that every student feels like they are a part of this community. At the same time, you have the resources that you would expect with a large, world-renowned research university. We have, incredible library resources for students to do, to utilize whenever they're doing research and papers and so forth. There's we have a dedicated health sciences librarian. We have a writing specialist here. We've got lots of resources for you to utilize as a student here that smaller institutions might not have, but still everyone here is going to know your name. We've got flexible research-driven programs. So we want our programs to be cutting edge and to be providing the most up-to-date and important information for people to carry into their career wherever that takes them. But we also want our programs to be doable, right? We know that a lot of students coming into our graduate programs, I would say nearly all of our students are working, most of them full-time, and they need a program that meets their needs, that they're not going to have to let one thing suffer because they've, got too much else on their plate to think about school. We really do strive to make sure that this is an environment where everyone feels, again, supported, but that you feel like you are capable of doing what is required of you. So we are happy to work with you to make sure that you've got the flexibility you need to do the work that you need to do. And if you need to, change things up from the typical plan of study and, make your own path, we're happy to work with you on things like that. We also have one of the world's largest active alumni networks at Penn State. Some of you may already be Penn State alums. You might be familiar with the Penn State system. Everywhere you go around this world, basically, you're going to find someone with some kind of Penn State connections. And those connections will pay off for you professionally in ways that you might not realize until those opportunities present themselves. So do not discount the opportunities that a Penn State degree affords because you could be surprised by just what doors are open for you because of it. We were also named a Center of Excellence in Nursing Education by the National League for Nursing in 2022. That is a designation that essentially means we've got the best of the best when it comes to our teaching faculty. We have faculty that are experts in their field. They know what they are doing. They know how to teach, and nursing pedagogy is a specialty for them. So you can rest assured that the education you're getting here is from people who are well acquainted with their work, with the art of teaching, with the importance of research-based programs in educating the next generation of nurses. So that's a designation too from NLN that we are hoping to renew for this coming year. We, I think, have just submitted our paperwork for renewing that designation, and we are very confident that we'll get that once again because our faculty just continue to get better. All right, so now that you know a little more about us, here is a list of what we currently offer. Like I said, we have the PhD program. That's not one that we're going to be focusing on in this session. That one is offered in person at University Park in State College, Pennsylvania, and at Hershey Medical Center in Hershey, PA. The bottom three here are going to be the ones that we are focusing on today. So the DNP with the exclusion of the nurse anesthesia. Those are hybrid options. So there'll be online coursework with on-campus intensives and some practicum hours that you would complete near you. We've got MSN options that again are considered hybrid, more online. With these classes, there's only one course in each of those options that requires the practicum hours, but still not 100% online, so we consider it hybrid. And we've got our graduate certificates. So we've got two that are 100% online, and then we have our postmaster's APRN certificates that are more of that hybrid model that you find with the DNP, where it's on-campus intensives and practicum hours near you. So with that, I'm going to turn it over to Dr. Motter now to tell us a little more about our DNP options.
Sure. Thank you, Cody. Just a little follow-up on some of the things Cody had mentioned. One, with CCNE, we have handed in our mid-cycle review. So 10 years is a long time between when they come and certify us. So in the middle, the 5-year mark, you have to say, hey, here's what we're doing and here's what we've done. So that has gone in, and we have every reason to believe we are certified for the next 5 years. It's a 10-year certification, but they kind of keep you in check too, so we don't fall off the radar screen. And the other thing is, and Cody did mention this, but it's really important to each of us that there's a work-life balance. And when you come and join us, you'll see many of our courses have wellness components to them. And historically, I used to hear things from other programs, like where I got my PhD, not through Penn State, was like, okay, you make a choice. You have work, you have family, and you have school. Pick two, because that's all you're getting through right now. We are true believers that you need all three to be successful and keep a steady stool. So work's important, family's important, your schoolwork's important. And there is a way to balance that. And people always say, well, I work full time. 98% of our students, and I'm taking that off the top of my head, but I would be surprised if it isn't at least 98%. 98% of our students work full time. Many have babies, many get married. I don't recommend a honeymoon in the middle of a semester, but hey, up to you. But life does go on. And yes, this is a commitment, just as your work is a commitment, just as your family is a commitment. So we see it work all the time that you can balance all three. So I need you to rest assured that is happening within the program. So we have several options in our DNP program. We have the leadership option. We have a new option, which we have our first cohort of students that started this spring, and that's our nurse educator option. And I'll talk a little bit about each of them in a minute. And then we have our nurse practitioner options, which Dr. Ryer will speak to, and Dr. Farrell. And then, as Cody mentioned, the anesthesia program is expected to launch in summer of 2027. They're saying they lost audio. Did everyone lose me, or can you guys
I
still
can
hear me?
still hear you.
Yep.
Okay. Okay. And the site visit, our document is in for the nurse anesthesia program. I have every reason to believe that it will be approved, and they will be here on site in April of this year to do their site visit. And then once we get our approval, it will open and we will start to take admissions. I will tell you the first class is limited to 15 students because we want to do it well and make sure we're doing it right, which I have every reason to believe we will be. We didn't bring in novice leaders for that. We brought in leaders from other organizations, and they have just done an outstanding job getting us up to speed. Okay, so just a little bit about our DNP leadership option and educator option. It really does prepare nurse leaders for the future, and that's from middle management to CNOs. And we also historically saw nurse practitioners who came back for this, who wanted to get into education. So we now have the education component, but there's also leadership roles as nurse practitioners. So if someone has their master's, an NP with their master's, this is a great option to come back. And I am happy to say in more and more organizations, I am seeing advanced nurse practitioners or nurse practitioners having leadership roles and leading the nurse practitioner team instead of being led by physicians. So this is an option for that. There are two paths. One is BSN to DNP, which takes 61 credits, and the other one is MSN to DNP, which is 38 to 46 credits. Now, that being said, we always look at transcripts and see where we can give you credit for recently taken courses. And the policy of Penn State is you need to take your last 30 credits at Penn State. We do have students who come in who have a master's, who've taken courses. We're not going to be redundant and say, okay, we're going to waive this course. And sometimes it takes less than 38 credits. I'm not saying it happens often, but it does happen, especially with our nurse practitioners because they come in with a lot of hours, so their practicum hours are waived. The practicum hour total is 1,000 credits, and up to 550 can be transferred for an MSN credit. So when people come in with their NP, and it's amazing, some educator programs also have about 550 hours. The rest of your 450 hours can be that they happen in your scholarly project courses and in your leadership courses. So it's not like you have further practicum hours. Those are all within your coursework. Next slide, please, Cody. And then the nurse educator option looks very much, it was modeled really with our leadership program. And we just focused the leadership components on educator components. So there are 3 courses that are educator focused instead of leadership focused. The scholarly project courses remain the same. It doesn't matter which program you're in. And I think I speak to that later. Nod your head, Cody, if that is true. I think there's a scholarly project slide, right? Next. And again, 550 hours can be applied. The next caveat I'm going to say is true for any of our programs. We really try and help you find practicum and clinical placement. And our alumni association, as our program graduates more and more students, we are finding ready and willing preceptors. For the DNP educator and leadership programs, it's a pretty easy process nationwide. When we get into the NP program, there are new hurdles we have to jump, and we are starting to explore outside of the state of Pennsylvania. So we have accepted students who are not from Pennsylvania, and we will continue to work through that and maybe Dr. Ryer can speak to that a little. There are certain states that make it very difficult for out-of-state schools to apply and have a successful program in their state. And we think it's better for those students to go within their state. That being said, in the state of Pennsylvania, I think we reach every corner of the state. In fact, I can't think of a corner we don't reach where we have students actively in the program and active with preceptors. We have Dr. Maynard who helps us find placement. We also depend on our students. We really try and help you find that placement. We will help you navigate it. But sometimes you know your area better, you know those leader nurse practitioners better. So if you have a preceptor or know of one and you can make your schedule work with them, go at it. If not, we're here to help you. So please know that we really do have preceptors, adjunct faculty across the state, and now we're branching that out beyond our state borders. So we do help you with that, which isn't true of every program. Many make you go find your own preceptors and can be a rate limiting factor. All right, Dr. Ryer.
Yes.
I think that's my last slide. Yep.
Yep. So I'm going to talk about, I'm going to talk about some of the nurse practitioner options. And what I kind of want you to hone in on, if you're here for a nurse practitioner option, is at the top of each slide, I talk a little bit about that nurse practitioner's scope of practice. So this question comes up a lot between the specialties. Well, you know, what is an FNP versus an acute care NP and psych mental health? So hopefully we can help you tease through some of that with this as well. So the family nurse practitioner, or FNP, their scope of practice is really across the lifespan. So they can provide comprehensive care across all ages, and they emphasize their care in preventative measures or preventative care, chronic conditions, and they dabble a little bit in some uncomplex acute care needs as well. So your FNPs, you're largely going to see them out in the clinics or in the outpatient environment. You can come into this program with either your bachelor's or your master's. Again, like Dr. Motter had mentioned, if you do come in with your master's, we do a analysis of your transcripts, so we're able to see if there are some courses that you can bring into the program with you. Otherwise, it is 58 credits. You will get 750 clinical hours in this program and 431 doctoral hours. So with this program, as well as our other NP to DNP options, you're going to be learning and wearing two different hats in the program. You're going to be learning the nurse practitioner role and wearing that hat, and you're going to be learning the DNP role and wearing that hat as well. And our coursework is really structured to walk you through a lot of that. And I think we talk a little bit about our DNP courses in terms of the project a little bit later in the presentation and kind of what those look like. The 750 clinical hours, if you're looking at other schools across Pennsylvania or in other parts of the country, you will see that that piece can vary. It's a national debate right now amongst nursing faculty as to, what's the sweet number of clinical hours that needs to be addressed. The state of Kansas has recently just forced some of us to make this decision. In order to be licensed in the state of Kansas as a nurse practitioner, you have to have 750 clinical hours. So I would just advise you to look at the program, look at the state that you want to practice in, and see what some of those requirements are. And so we have raised our bar a little bit to ensure that all of our graduates are able to go anywhere throughout the country and practice as a nurse practitioner and apply for your board certification. FNP graduates are eligible to take the National FNP certification, and there are a couple different organizing bodies that you're able to sit for. I believe AANP is one of them and ANCC is another, but don't worry, we introduce you to those organizing bodies in one of the last semesters of your coursework. So next we're going to look at the adult gerontology primary care nurse practitioner. So this group of nurse practitioners manages healthcare for adults and older adults focusing on health promotion, disease prevention, and management of acute and chronic illnesses. So you may say, well, Dr. Ryer, that sounds exactly like the FNP. And you might be right, except for this group does not do peds at all. They do not do pediatric clinicals. They do not do pediatric didactic material. Okay, so if you're not interested in pediatrics, but you're interested in the outpatient arena, this might be the option for you. This option, again, you can either come in with your bachelor's or your master's, 55 credits. You'll notice it's just a touch lower than the FNP because we're not doing the peds in this program. Same amount of clinical hours, the 750, same amount of doctoral hours. You're wearing both of those hats at the same time. And then this option, you are also eligible to take the national certification exam as well, which I believe are the same two options. But again, when that time comes, we kind of walk you through that process. So FNP and adult gerontology, primary care, both focus on health promotion, disease prevention, and chronic disease management in the outpatient arena. Next, we're going to switch over to the adult acute care option. So this is my specialty. I'm the track coordinator for this. And what this nurse practitioner does is we manage our scope of practice is taking care of patients, adults and older adults with acute, critical, and complex chronic health conditions. Now, the acute care nurse practitioner, large and short, is typically on the inpatient side of things. However, with the complex chronic piece of our scope of practice, you will see us sometimes in specialty clinics, neurosurgery, neurology, Coumadin clinics, advanced heart failure, some of those clinics where those patients really have complex needs. And in that case, our scope of practice covers up for those complex chronic health conditions. Again, you can come in with your bachelor's, you can come in with your master's. We have a total of 57 credits, same number of clinical hours as everybody else, 750, and then 431 of those being doctoral hours. And our graduates are eligible to take the acute care boards, which either comes from the AACN, so if any of you are already critical care, the American Association of Critical Care Nurses, or the ANCC. Now, for this program, we do require that you have 2 years of acute care work and experience. And this can vary. This can be, nurses who have 2 years of med-surg, tele, or IMC level of care, or ICU level of care. Just because you don't have straight critical care experience, that does not mean that you are not a candidate for this program. Okay, so as we're reviewing applicants and we're talking with you, we do talk through a lot of that and really take a more holistic approach to what your clinical experience is as a nurse. And I think a little bit later, I'm going to talk a little bit deeper about the clinical practicum hours and our in-person intensives. So if you have any questions about those, stay tuned in a couple minutes.
Hi, I'm going to talk a little bit about the psych mental health nurse practitioner option. So you can see that there are 750 clinical hours of 431 doctoral hours. So that pretty much is standard throughout all the programs. The one thing that looking at some of the programs, if you're doing some comparison, is to really look at how well the clinical experiences are structured and what the outcomes of the program are. So our programs are looking at creating an opportunity for the student to be prepared to take both the complex and then the simpler mental health needs of clients. And the complex ones are really a challenge. So again, the student experiences go across the lifespan, but we look at clinical experiences in both outpatient and inpatient settings simply because of the differences among patients and then also generally the acuity of the patients. So that's one of the pieces that, we are hoping that students then are eligible at the completion of the program for the clinical portion of it, are able to take either one of the certification exams. And again, to check with their state to see which certification exam is going to be allowed, because some of the states only it will allow one or the other of the certification exams. So I think it's a great program. I think that it is patient-centered, and we're really looking at tuning in those clinical experiences to really help the student feel competent at the end of the program.
Thanks, Dr. Farrell. I think we're going to throw it back to Dr. Ryer now
Yep,
for.
I can talk about this a little bit. So, most of our plans of studies are very similar, if especially in the DNP track, obviously, whether you're a DNP leadership or educator or DNP NP option, our plans of study are pretty similar. It's the typical completion time is 8 semesters. So just a semester shy of 3 full years. It may be a little bit less, of course, if you were coming in with your master's degree and have some of those credits that you're able to apply. All of our courses are offered asynchronously online. And so what does that mean? That means that we are offering the coursework online typically in module type content. So the course is built out for you already, and we are not meeting every Tuesday at 2 p.m. for Zoom, or every Thursday at 5 p.m. to listen to lecture. The lectures are in the week's module for you. And so this works really well for our students who have a busy life and are working full time, because they're able to log in for the week and look at where their assignments are due in that week. You will have weekly assignments typically, but you can then set it up for what works for you. So let's say I work Monday and Tuesday and Wednesday this week. So maybe I can do my coursework Thursday, Friday, and have everything submitted by Sunday. So that's what asynchronously means. That means that we're not meeting every week at a certain time. Now, you may have some courses that have office hours or, special guests that come in at a certain time each week. And all of that is typically recorded for you. So if you're not able to make it to that event, you certainly would have access. The practicum hours, whether you're doing practicum hours for your DNP project or you're doing practicum hours for, if you're in the nurse practitioner, your clinical hours. These, again, we work with you to find. So as Sherry or Dr. Motter had mentioned, Dr. Susan Maynard is really our coordinator for this. We have somebody who, is sitting in this seat to help us with this. If you can come to us, you know what's around you possibly a little bit better than we do, depending on what area of the state you're in or where you're located. And so if you can come to us with some suggestions, we're then able to do a lot of the legwork, the affiliation agreement, the legal stuff that has to be signed off, connecting with the preceptor, getting forms signed. So that's what Dr. Maynard does. So it is super duper helpful to have somebody that does that full time for us. And she's our gal that helps us coordinate that. Certainly, we have a ton of different networks across the state of Pennsylvania where we already have well-established practicums set up. And so certainly in some cases, you can just tell us, what you're looking for. I'd like to do cardiology or, this family practice or neurosurgery. And we're able to kind of access our networks and see what we may be able to find for you already. Our in-person intensives, these are awesome. This is what makes our program, I think, I'm biased, but really, really special, because yes, we're online and you're doing a lot of stuff online, but we bring you back in person 3 times, depending on what program you're in. For DNP leadership and educator, you're doing this twice in your program. And then for the DNP and NP options, you're doing this 3 times. And so we bring you in at first for orientation. You get to meet faculty. You get to see who your advisor is. We talk about what the DNP project is. So we really get to meet everybody at the start. And this is a wonderful experience. It's at State College. So you get to come to Penn State and experience the Penn State or State College town a little bit. And then if you're in the NP option, you'll get to come to Hershey Medical Center in Hershey, Pennsylvania, which is where our simulation lab is. And so for the other two intensives, the first intensive or the second intensive for the NP option, we bring you into the simulation lab and we're really we're really testing off on your health assessment. So yes, you've learned your health assessment stuff online, but we bring you in person and we teach it to you in person, and you're able to work in the simulation lab with live models to help you get comfortable with these skills. The third in-person intensive for the NPs, we again bring you back to Hershey Medical Center, and now we're taking it a step further. So we do some more complex cases, some more complex simulations. Our FNP students spend some time doing some of the specialty clinics like ophtho and women's health, and really getting their hands on some of those specialty areas and learning ortho and splinting. So these in-person intensives are awesome. You really get to bond with not only your cohort, but with us as faculty. And we really, really do all value getting to know everybody personally, and getting to set up that relationship together. So in-person intensives are one of our favorite times. Sorry, I talk too much. I think I'm
All
passing
good
it back to
stuff.
you, Dr.
Yes,
Motter.
going back to Dr. Motter now for more information on the project.
Yeah, and just those pictures on the last slide were actually pictures taken during our comprehensives when the leadership students came together to do their comprehensive exam, since that's their second time to be on site. And that is a Penn State University requirement, that there have to be at least 5 days in residency during any doctoral program. So you're wondering, why do they keep bringing me back here? That's why. Plus, it really does build camaraderie with your cohort. And even though we aren't a true cohort model, the leadership students kind of learn to know each other and work together. And I'm sure that's what's going to happen with our educator and with our NP students. And I always say graduation day is one of the happiest days and one of the saddest days for me, because we say goodbye and hope we hear from our students again. And I will say we do hear from our students again. We get the celebration letters when, hey, Dr. Motter, guess what? I just got this new job. And I used my scholarly project to sell what I was able to do for this organization. So that leads me into our scholarly project, and why do we make you do this scholarly project, and what's it all about? Well, I will say we heard the concerns and have changed our scholarly project a bit. It begins with looking at a problem, both nationally and locally. And when we speak locally, we're talking about the stakeholder organization that you will be doing your project. So is there a problem? What is the problem? What does that data look like nationally? That happens very early on in the process. You and your advisor work through it. We do it in many courses. From there, I would say 90% of them are quality improvement projects, but we also have program evaluation. We have someone this year working on policy. And as a little celebration, we had someone work on policy in the past. She was in the state of New York. She worked on a policy change at the state level where CNSs could prescribe in their area where they were a CNS. So she was a CNS in a critical care area, and she had prescriptive privileges in that critical care unit. She now works for AACN and working on developing that policy at a national level. So good things happen. We want these scholarly projects to be something that's applicable. Hate that word, but I feel like I need to say it. And my history is I was a CNO historically, and I loved process change. I love challenging our current processes and how to improve things. But you know what? As a CNO, I wasn't going to read a 120-page document that someone had worked on and said, here, I think we should make this change, and here's everything that it's all about. So we have taken our scholarly project and moved it from this 120-page document to something that you can put in your toolkit and use to change things. So we still start with the problem, both nationally and locally. We have your stakeholders. We do go out and you research the problem. You find the evidence. You support it or don't support what's happening in the literature. So 831 is our first scholarly project course, and that's where you do your lit search. You do a lit table. You go through the process, because if you're going to present something to your CNO, to your board, or to wherever, you really do need to have the background. Then we spend, so you write a paper about that, but instead of continuing to add to that paper, in 837, which is where the comprehensive exam is, we start to write on how to write a proposal, how to present that proposal, pared down to maybe a white paper, a small white paper of 1 to 2 pages about, hey, we have this problem and I've done a lit review and here's what I'm finding in the literature and here's how we can make a change. So it's giving our students the tools to go out and implement change, because we know if you're in the DNP program, you're not going to go out and continue to write paper after paper, right? For the most part, you're going to want to have the tools to make changes. Then there are 3 sections of 835. You do it in the summer, you do 835 again in the fall, and you do 835 again in the spring before you graduate. After you present your comprehensives and we have a plan, you take that plan and the following summer you implement it. During that summer's 12 weeks, and there are times that it doesn't fit. Majority of the time we can make it fit. But if we have someone doing something in academia and there's no one in classes in the summer, well, you can't implement, right? So we hold them off to the fall and we get them back up to speed. But we implement routinely in the summer, sometimes not. Then we're gathering our results. In the fall, you're looking at the results, all with support of faculty, statisticians. We have the support. We're also under the philosophy of you're not going to come out as a statistician. We need you to understand the statistics. We need you to be able to look up and say, that doesn't make sense or that does make sense. But we're going to give you the support you need to understand the results you get. And Dr. Barish, you meet her week 1 in orientation, and she becomes a dear friend to many. And then we have the final oral presentation where you take the comprehensive exam is presenting what your project's going to be. You take that same deck of slides, you put it into past tense because it's done now, and you add your results. So really, final oral presentation, a majority of the work is done during comprehensives and during that fall semester. So by the time you're like, oh my God, can this soon be over? Because we all get burned out towards the end. Most of your presentation is ready to go. And then we prepare you, if you want to publish, we help you prepare a document. We ask that during that final semester, you either do a poster presentation or prepare something to be published. We do not demand that it be published because we're hearing from editors from many journals that has become part of DNP programs, and they're getting inundated with all these things that people really don't want to publish. They just have to check the box for their courses, and we don't believe in that. There are many opportunities to do poster sessions through Penn State, and it really, you spend a lot of time on this, you might as well celebrate it. And we do have many of our students presenting, one nationally. We've had 2 people present at National Sigma organizations so far this year from our group that will be graduating in May. We have someone going to ERNS, which is the Eastern Research Society. And then we have many presenting their posters throughout Penn State, throughout the state, and at our conference in March. So we don't want you to just say, oh, okay, done, check. We want you really to promote your work. Next slide. Oh, I already talked about these. So, and here you can see where practicum hours are built in. So this makes people a little nervous and like, I'm already taking this 3-credit course. Now, where am I going to go get those hours? They're built in the work that you're doing for that course. So you document them, but you're not out spending another 75 hours. The 75 hours are in that course. And Cody, we need to change this screen because 831 is now a 4-credit course and includes 75 hours. So
Noted.
That's
Thank
my
you.
mistake for not seeing that earlier. Thanks. Our admission requirements. So we admit students throughout the year. Admissions are coming in all the time. And it's funny how it seems like the nurse practitioner students are largely in the fall. Our leadership students, and we saw this with our educator students, are largely in the spring. And it's fine. Whenever you start, you start. The traditional plan of study starts in the fall, but if you start in the spring or the summer, you can get a couple courses off your docket, kind of get into a cadence. So whatever time works for you, works for us. And we do look at these applications every week. And I will tell you the biggest holdup is who your references are. You need 3 references. And we do ping your references and say, hey, you haven't done it yet. Hey, you haven't done it yet. And after we've pinged someone several times, we do pick up the phone and call you and say, do you want to pick someone else? Your reference isn't responding. Quite often when the student calls that person, they do it that day. If not, well, find someone else. Undergraduate GPA of 3.0 or higher, B or higher in your science courses. We have taken chemistry out as a requirement. So if you see some old things laying around, I think we cleaned it up. But chemistry isn't being offered in many undergraduate programs anymore as a pure course. The chemistry is blended in the other courses. So we did remove that. You do need a bachelor's in nursing and a valid license. And as Dr. Ryer said earlier, our acute care option and our nurse anesthesia option, we ask for 2 years of either acute care or critical care experience. The rest of them, it's what you can handle. We have brought in students who just graduated in May and they start in August. It works for some, it doesn't work for others. I think it depends how your transition into practice happens. Some people have been working at a site forever as students and it's very comfortable to them. And, they start out as an RN and it fits very well for them. Others get a little dose of reality shock and need a semester or 2 to get themselves practicing clinically before they start the program. Again, entirely up to you of how that works. And sometimes people start and say, whoa, I didn't realize it was going to be like this. Can I slow down my plan of study? Yep. You can slow it down and say, I just want to do 1 course for a year and then pick it back up next year. Okay, fine with us. And we really do adjust people's plans of study frequently. People say, I want to slow down. People say, I want to pick up the pace. People say, I need a leave of absence. All okay. It'll work. So we do have 2 Master of Science in Nursing programs. We have the administrator option and the educator option, both 36 credits. The only time that you need to be in person for anything are your practicum hours. The nurse administrator has 180. The nurse educator, Cody flipped too early, has 270. You didn't. There's exactly what I'm talking about. And it's offered full-time, part-time. And again, people come in and out of this program, full-time, part-time. I want to take summer courses. I don't want to take summer courses. So it really depends how you play out your courses of how quickly or slowly you go through the program. I do meet with every leadership student, every DNP leadership and educator students, as well as every MSN student. And we talk about, do you want to take courses in the summer? Do you not? When do you want to start? And we rearrange it based on your life. The only thing that there are certain courses that are only offered certain times of the year. And the other piece of that is the practicum courses, your capstone courses are always in the spring. We do have people do their capstone course and graduate in the summer or fall because they have 1 or 2 lingering courses. But for the most part, people graduate in May. But sometimes if you start in the spring, maybe you're going to graduate in the fall. It's all okay. So we talk through that because there are required courses before you take your capstone course. And that's where you get your 180 and 270 hours. Same admission criteria as for our DNP. The other thing is students who take these courses, they are quite often the same courses you take in our DNP program. So very often you need 30 more credits once you graduate with your master's. You're like, hey, that wasn't so bad. I should have gone for the DNP. Time is not lost. You need 30 more credits and you can graduate with your DNP. And we figure out which courses you've already taken and what we can waive and get you to those 30 credits. So we have post-baccalaureate certificates. Nurse administrator, nurse educator, it's 3 courses. Those are 3 for each program. They are 3 of the core courses that are in the MSN degree program. So let's say you come and say, I'm going to do this nurse administrator thing, and you take the 9 credits and you're like, you know what, I'm so close. I'm only 20 some credits away. I might as well go back and get my master's. These are not lost credits because they're not used towards a degree. Those 9 credits count towards your master's, and they are the same courses. So if you're taking, let's give the administrator, for example, you take a course in finance, you take a course in HR, and you take a course in leadership. They all transfer directly into the MSN program, and those credits are not lost. You get credit for them. And then Dr. Ryer, I'm going to let you talk about the NP options.
Yep, sure. So all of our NP programs, except for nurse anesthesia, has the certificate option available to you. And so what that means is you come to us with your master's or higher already, and we are able to put you in a postmaster certificate program for whichever specialty track you're interested in. This plan of study varies a little bit. It depends what you come to us with from your master's degree and how recent some of those credits were. But it typically is about a year, year and a half is when most students are able to work through the certificate program. So if you've already got your master's degree or higher, this is an option for you for any of the NP tracks except for anesthesia.
All right, thank you. I am going to pick it back up here and talk a little about what you can expect in terms of applying for the program. So as we've already mentioned, we accept students for spring, summer, or fall semester for really any of these programs. Our next application deadline is going to be March 1st if you'd like to start in the summer. So we're about a week and a half out. If you have not started an application yet and you want to get it in, you still have a little time, but get moving, I would say. And if you don't have everything in exactly by March 1st, we can work with you, give you a couple days leeway on that. It's not too big of a deal. Classes will start for the summer on May 18th. You can also apply now for the fall semester if you'd rather start then, or if you aren't going to get everything in, by early March. June 30th is our deadline for fall, with classes starting August 24th. Either way, if you're looking at a DNP program and starting in either summer or fall, you would be coming to that fall orientation in August. So if you're taking summer classes, you might do a class or 2 over the summer before you do the orientation. It's not really going to put you at a disadvantage to do it that way, because those courses that you would take in the summer aren't related to the DNP project yet. So, the information you'd get about the project there at orientation is, you'll be fine to go a semester without that if you choose to start in the summer. We also do have the application, I think, open already for spring of 27. If not, it probably will be open soon. And October 1st is our deadline for that, with classes starting January 11th if you're thinking a little further out. All of our applicants must complete the Penn State Fox Graduate School application. So if you go to gradschool.psu.edu, you would come here to the Apply button toward the top right of the page. That page will have the full descriptions of what you need to do. If you've previously been a Penn State student, you would go through your existing account or recover your account. Thank you, Morgan, for putting that in the chat. If you've never been within the Penn State system, you have to create an account in order to get started, but it's pretty self-explanatory, laid out step by step to go through the application. And you can always save your progress and come back later if you don't have it all finished in one sitting rather. All of our applications do require official transcripts from all the post-secondary institutions you've attended, both for undergrad and if you've done any graduate. If you don't have all of those official transcripts now, say you are trying to get in for March 1st and you aren't sure you'll get those transcripts in time, but you have unofficial copies, you can upload those to the application for now. That's fine for your initial review of the application, but we do have to have official copies on file for you before you can enroll. So you would have to still have those sent. Those can be sent to gradschooltrans@psu.edu. That's the graduate school's transcript email. And again, if you have questions about any of that, please feel free to reach out to me. I'm happy to help with clearing up any of those kinds of questions. We do require everyone to have a bachelor's degree, at least in nursing, from an accredited institution in the US or an equivalent degree from an institution in another country. If you did complete your schooling in another country, there's a good chance you would need to submit English proficiency test scores unless your home country has English as an official language. It's not too often that we come across people in this situation, but again, if you have questions with any of that, feel free to reach out to us and we'll be glad to help clear any of that up. Our DNP and MSN options do require a personal statement, so you'd explain a little bit about your career so far, your reasons for wanting to pursue the degree that you're looking at, and any other information that may be relevant for the admission committee to know. You also need a couple of references, as we've alluded to before. You don't need to have letters written by these people. You would just submit their email addresses, and they would get an automated email when you submit the application. They would fill out the form that's attached to that email for you, and your application would be considered complete when they have submitted that form. So I would suggest as soon as you submit the application, let those references know that they need to have an eye out for that email so they can get that done as quickly as possible for you. There are a couple of other requirements that vary by the program. DNP students, for example, need to do a writing sample. So there are specific things we're looking for with that. You can find the full list of what's required for each program on the appropriate program page. Each one has their own landing page on our College of Nursing website. So go to nursing.psu.edu. Under the academics tab, you'll see everything lined out. All right, now the big question of how much is this going to cost me? We do have a current tuition rate of $1,061 per credit. That is the rate that is charged for students that would be paying per credit if you're taking less than 12 credits per semester. If you're taking more than 12, it becomes a flat rate. I don't believe we have any students ever taking more than 12 credits per semester in any of these programs, so you shouldn't have to worry about any of that. One thing we do want to note is there could be a tuition increase for students that don't reside in Pennsylvania starting this summer. We don't exactly know what that rate is going to be yet. When we figure that out, we'll have that information available, but just keep in mind it could be a significant increase. Most of our students have historically been coming from Pennsylvania, but we just want to make everyone aware, since we do have students really across the country. We have people here and there, that there's a chance that tuition could be increasing for you above that 1,061 rate. A few of our DNP or MSN students receive scholarships through the college each year. There's not a ton, unfortunately, not as many as we'd like to see, but they're usually for a few $1,000s at least. And all of our students are automatically considered for those based on your FAFSA information. So just make sure you submit that FAFSA. The awards then are decided each summer, and you're notified if you'll be getting one for the upcoming year. But a lot of our students have more success finding scholarships or grants from external sources and loans. I do want to mention too, there's been a lot in the news. You probably are all aware about the shift of nursing to not being considered a professional degree for lending purposes. The maximum under the new designation to borrow for a year is $20,500. Uh, Most of our, I guess, doing the math here, at the $1,061 rate, that comes out to probably around 19 credits that you'd be able to take for the academic year on the amount of money that you'd be able to borrow. Most of our students are taking somewhere around there per academic year anyway. So, if you're doing a full-time program, you might exceed that. But most of our students, under the current plan that they're on, probably can get by. If you are taking out loans for the entire amount for each year, you probably, won't feel that pinch too much. You might have, if you're doing more than 19 credits, you might have a few $1,000s still out of pocket. But a lot of our students are utilizing tuition reimbursement or other assistance from their employers as well, which can cut down that cost. So, there's a lot of hoopla right now, and we wish it wasn't happening, of course, but don't get too daunted by the idea that you'd be, dishing all this money out of pocket, because there's a good chance that, that there are avenues that you can pursue that aren't going to, leave you with the entire burden of the financial responsibility. All right. With that, we're going to wrap up the presentation here. Sorry, it took a little longer than I think we all talked more than we thought we might, and that's all right because I think we gave you some good information. Thank you to those of you who hung in with us here, and we are happy to stay on for as long as we need to answer whatever questions you have. You see, with this slide, we've got contact information for all of the directors, coordinators, leadership of our graduate programs. So please feel free you can screenshot this if you want now, or I will also send the slides and the recording to everyone who's both attended and registered who wasn't able to attend afterwards. So we've said it several times, but don't hesitate to get in touch with us if you have questions you don't want to ask online here. If you would rather have a private conversation, we're more than happy to do that. But since you have us here, we are more than willing to answer any questions that you might have. If you'd like to pop those into the chat now, or raise your hand, turn on audio and or video, and we will be happy to answer any of them.
Cody, one thing I wanted to mention is if you are applying to start in the summer or the fall, those dates for the in-person orientation are August 17th, 18th, and 19th. Important dates if you are planning on coming this summer or fall.
Thank you. I meant to mention that as well, and that forgot to share the actual dates. All right, I know we had a couple of questions in the chat there, but please don't be shy. Maybe we did better than we thought answering every single question that anyone might possibly have.
Maybe it pays off to be a talker.
Maybe.
Sorry, hi, I have one.
Yeah.
I
Christina.
was trying to type it in, but it was too much to type.
Oh.
I'm actually on the admission application, like the website right now, trying to apply for the program. But it's showing that there's currently no available admission semester for the selected program for 2026 and beyond. So I can't go beyond the first part of the application, which is weird.
Did you already select a program?
Yep, so I'm gonna show you my can I like do my camera around somewhere? I don't know. I'm trying to do it on my so like it says, I don't know if you can see it. It says
Kind of.
it says we're sorry there are currently no available admission semesters to the selected program from spring of 2026. So I can't go.
What program did you choose?
Acute care NP.
So you chose spring. You need to pick summer or fall. That might be why.
We're already in spring.
Because we're in spring right now.
Oh, no, it's like it's asking, so like the enrollment type, it says degree admission, and then obviously World Campus, and then it says
No,
the major is
it's
obviously nursing.
University
Yeah.
Park. We've moved to
Oh,
University
University
Park and out of
Park.
World.
Okay,
Yes.
got it.
Yep. Now see if you get it.
Yeah, see what comes up now.
Okay, let's see here.
Yeah, starting this summer, all of our programs are being run out of our part of the university rather than through the World Campus. So
That should come down soon, I would guess.
yeah, I'm thinking it should have, but does that give you options, Christina?
Yes, it does. Thank you.
Perfect. You're welcome. Glad you asked.
you.
I'm sure others had the same confusion.
Yeah, and feel free to email me, Christina, if you need to. I'm happy to help.
Yeah, just in case anyone was wondering, because we've had people that maybe were in the pipeline here thinking about it for a while. Our DNP and MSN and certificate options previously were all offered through Penn State World Campus. We made the transition for those programs to come to the University Park campus, even though there have been no curricular changes with those programs. It's really just to better underscore the fact that these are programs that are not 100% online, which is how World Campus prefers to market their programs. So just clarifying the fact that there are some integral in-person components, both the on-campus intensives for DNP students and the practicum hours that
And
you do near you.
Cody, let's answer Colleen's question out loud because I'm sure others might have this. For transcripts, is it an upload of the official transcript within the application and to the email as well?
So I believe if you attach the official to the application, you would not need to send directly to the grad school. Some people some institutions don't like to send official transcripts to individuals directly. They prefer to send to another school. So if you don't have official transcripts yourself, you might need to arrange to have those sent directly to Penn State. You're welcome. Any other questions out there? I don't see anyone chiming in, so I think we are going to go ahead and wrap things up here. If you still are thinking of a question, feel free to pop that in the chat right now. But once again, just want to say thank you to all of you for joining us. We hope this session has been informative for all of you, and a reminder that any of us would be happy to talk with you again, answer any questions that you have individually, anything that we can clarify for you, even if you aren't considering applying for a little while yet. Just stay in touch, and we can keep you in the pipeline here and make sure that you're ready whenever the time does come. I see we've got a question. Is the application fee compulsory? Yeah, all students do have to pay that $65 application fee. We aren't able to do waivers, unfortunately.
And if you're worried and you don't want to pay the fee and you'd rather reach out to talk through your case or to talk through, am I even a candidate? Just email us, and we're happy to kind of sit down and peripherally check off boxes with you and see if you're a match or, if it's really a good fit for you too.
Absolutely. Okay, well, I think we will wrap it up here then. Thanks again to all of you, and wish you all the best. Again, March 1st is that summer application deadline, so get to work on the application if you are thinking of getting in then, and don't hesitate to reach out if we can help you with anything along the way. All right, thanks again, everyone. Take care. Have a great weekend.
Bye-bye.
Bye.
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 Penn State.